Good afternoon, everybody. My name is Neil Hetherington. I have the awesome privilege of being the CEO of the Daily Bread Food Bank. I want to welcome you to this very important webinar. And first, we want to start our time together by acknowledging the land that this webinar is happening on. And to do that, I'm going to ask Jamil to come on. Jamil is one of our newest board members to the Daily Bread Food Bank. And Jamil is going to be doing that land acknowledgement now.
Thanks, Neil. I would like to begin by acknowledging the Indigenous peoples of all the lands that we are on today. So while we meet today on a virtual platform, I'd like to acknowledge that many of us are in Takaranto, which is the traditional territory of the Anishinaabe, Chippewa, Haudenosaunee, Huron-Wendat, Mississaugas of the Credit, and all those nations recognized and unrecognized, named and unnamed. This region is also covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. When I think about the land acknowledgement, I think about my own history. My family is more recently from the West Indies, whose lands were home to many Indigenous peoples as well, including the Arawak, Caribs, and the Kalinago, among others, who bravely resisted but ultimately suffered gravely under colonization. My ancestors were brought to those lands as enslaved and indentured laborers and faced a similar cultural destruction. Now, as a settler on Turtle Island, I reflect on how I inherit the traumas of colonization, but I'm also complicit in it, an experience shared by many immigrants to this land. I'm glad that the myths of benevolent colonization are finally being rejected more widely among Canadians. However, I hope to support true reconciliation by continuing to seek more knowledge and engaging in meaningful allyship with the Indigenous communities who, as we are especially reminded by recent news, continue to fight for their culture and sovereignty on these lands. As we reflect today on food insecurity and poverty in our city, as well as the chronic stressors that exacerbate vulnerability, it is important to remember that the legacy of colonization, systemic discrimination, and the separation of Indigenous peoples from their culture and lands continue to be some of the chronic stressors that impact the lived experience of many people in this city. I ask that you keep this context in mind as you reflect on the issue of food insecurity today. Thank you.
Thank you, Jamil. And thank you for the personal acknowledgement within the land acknowledgement. I want to continue that welcome and talk about why we are here at this Who's Hungry webinar. We released the Who's Hungry report last week, and in that report, there are some startling statistics. 1.45 million food bank visits in a single year, the highest number of food bank visits ever recorded in our city's history. It is 1.5 times greater in terms of the previous record that was set just after the 2008 financial recession. And for the first time, new clients outnumbered the number of existing clients in the sector. There is something fundamentally broken that needs to be repaired. And that's the purpose of this webinar, to look at the report, to understand the data, and to look at the recommendations that are possible and come together to say, how can we enact those recommendations? But before the numbers got as large as they did, I do want to underscore the fact that we were already in a crisis. This was a crisis upon a crisis, and our previous Who's Hungry reports have shown that. Today, we're going to be joined by an incredible panel. It says in my webinar block there that I'm Talia Bronstein. She's one of those excellent panelists that will be presenting in just a second, and it will be moderated by Kenda Ewan, host of the CBC News at 11 p.m. Kenda has many awards to her name, including a recent and documentary that I appreciated very much called "Come Sail Away," about the able sailing program at the National Yacht Club. She has been awarded a number of different awards, including the Monroe Award featuring that report. And her background is in and has always been in journalism. First in China, in mainland China, where she was the host of the English Chinese network, and then most recently at CTV in London, Ontario. She's a graduate of McMaster University with an honors in BA in English and Cultural Studies. She loves exploring our great city and is passionate about telling stories from diverse communities across the GTA. Kenda, thank you so much for being here today, for sharing your expertise and guiding an incredible panel through an important conversation. Thank you.
Thank you so much. Thank you so much, Neil, for that wonderful introduction. As Neil mentioned, my name is Kelda. I am the host of the 11 o'clock news on CBC Toronto. I'm very excited to be moderating this afternoon's discussion with our group of incredible panelists. Now, before we get to that, before I introduce them, just a few housekeeping items. Now, this Zoom meeting is closed captioned, and for all our audience members, your cameras and audio have been turned off. Now, at any time during the panel discussion, you can ask questions using the Q&A button on the bottom of your screen. So make sure to do that. And for those who are on the phone, you can also submit your questions by email to research@dailybread.ca. Now, we will try to answer as many audience questions as we can, but we do apologize in advance that we may not be able to get to all of them. And if that's the case, we will make sure to follow up with you afterwards, after the panel, or your question will be saved for a future event. Now, the panel discussion will go on till around 1:20, at which time we will be taking some of your questions and try to get to as many of them as we can. And finally, we will be recording this afternoon session, so you can check it out on the Daily Bread website after the panel as well. All right, now without further ado, I am thrilled to introduce our three incredible panelists this afternoon who we're so lucky to have with us here today. Now, I'll start with Tai Huynh. Now, Tai is the founding editor-in-chief of The Local, an independent magazine exploring urban health and social issues here in Toronto. He's also creative director at Open Lab, a design and innovation center at the University Health Network, and he's co-founder of Choosing Wisely Canada. Welcome, Tai. And we also have with us Jasmine Ramsey-Rezai. And Jasmine is the director of advocacy and communications at YWCA Toronto and a board member at a community health center called Access Alliance. She has worked and volunteered in the nonprofit sector for the past 15 years, including as a frontline housing and shelter worker. Jasmine is a strong advocate for gender equity, for racial justice and poverty reduction, and she is also a frequent media commentator. And last but not least, we have Talia Bronstein, the author of this year's Who's Hungry report. Talia is an experienced policy researcher with a passion for social change. She is currently the VP of Research and Advocacy at Daily Bread Food Bank, where she advocates for public policies that would eliminate poverty and food insecurity. Natalia holds a Master of Public Health from the University of Toronto and has spent her career working across the public, private, and non-profit sectors to build collaborative relationships between community members, partner organizations, and government to tackle complex systems level policy issues. So a huge welcome to all three of our panelists, to Tai, Jasmine, and Talia. Thank you so much for joining us on this panel this afternoon. All right, so let's get right into it. Now, the first question, Talia, I do want to start with you. Neil had mentioned obviously this report that was just released, Who's Hungry report released a couple of weeks ago, some startling numbers in there. We know that Daily Bread Food Bank and Northwick Harvest they're reporting 1.45 million food bank visits. This is, as Neil mentioned, the highest number of visits recorded in the city's history. Can you tell us more about what you found in the Who's Hungry report when it comes to who is accessing food banks and the experiences of these food bank clients?
Yeah, absolutely. Thank you, Kelda. So first, I just want to start by acknowledging my co-author on this report, Anwar, who you'll see in the chat is fielding questions as well. So, you know, Who's Hungry is very much a group effort published in partnership with North York Harvest as well. And the report is based on a survey we do annually. Of course, this year, like everything, it was a little bit different. We did it by phone and online, and we got over 1,500 responses from food bank clients across the city. And this report is really important to us because it helps tell the story of who's experiencing food insecurity and poverty in our city. So as you mentioned, we saw this 1.45 million visits, but the question is the who and the why. Who's coming to food banks and what are the circumstances that led to that? And so what our report found this year was, you know, we have seen a lot of long-term trends that have kind of come to a head this year with the pandemic as well. So we certainly see a disproportionate representation at food banks of clients with disability, of racialized clients, and I think we're going to unpack that a little bit throughout this webinar as to why we're seeing those kinds of trends in these communities. We're also seeing, as Neil mentioned, for the first time, new clients actually outnumbered existing clients. And so there was a really interesting situation unfolding there where our longer term clients tended to rely on social assistance. So in Ontario, we have programs like Ontario Works, Ontario Disability Support Program, and these folks are receiving very, very low benefit rates and relying on food banks, and they have very severe food insecurity as a result. Our newer clients, on the other hand, were more likely to have income from employment or employment insurance or the pandemic benefit. So that was an interesting trend as well. Overall, what we're also seeing is our clients are struggling in three areas predominantly: unaffordable housing, lack of adequate income supports, and lack of access to decent work. So for most of our clients, they were who were employed, they were working low wage, precarious jobs. And for the vast majority of our clients, housing remained the biggest part of their household expenses and was very unaffordable. So lots to unpack there. We'll get into it more, but you know, those were some of our high level findings from the report this year.
Thanks so much, Talia. Now, the Who's Hungry report shows that, as you mentioned, we're seeing rising food insecurity and poverty across Toronto. And food bank usage, as Neil mentioned, was already increasing before the pandemic, and then the pandemic hit and it just soared. So a question for all of you: what have each of you seen in terms of the impact of the pandemic on inequalities? I guess we can start with Talia, if you want to start with that.
So I think one of the really interesting things of this pandemic was that it was so unequally felt. So the job losses tended to be concentrated in lower wage work, and people, you know, the highest rates of COVID were concentrated in communities where there were people that had to leave their house to go to work. Those tended to be lower income communities. Those tended to be racialized communities. And these are no coincidences, right? At the same time, our report shows from the broader data that there's been huge wealth accumulation at the same time. For people who had higher incomes, you know, being able to work from home, saving on those entertainment expenses or travel expenses. The real estate market has just kind of exploded in terms of value. So there's been this dual trend of, you know, wealth accumulation, but also huge challenges in low income communities. And so I think that's where we see that inequality just that was already present continue to deepen during the pandemic.
I would agree with that. I think our work at the local throughout this pandemic has been to try to understand the neighborhoods in the city that have been impacted by COVID-19, and it's the very same neighborhoods that, Talia, you're referring to, low income, racialized individuals working in low paying, precarious jobs. And, while parts of Toronto, particularly areas like along the Yonge Street corridor that are largely white and pretty affluent, have pretty much been immune to the effects of COVID-19 and all the ills that come with that. So I think, yeah, I mean, these issues have been around for a long time, perhaps below the surface for many of us. And I think the pandemic has really brought them to the surface and magnified some of these inequities in pretty stark and troubling ways. And you see the food bank kind of being I guess, the tip of the iceberg in terms of being able to see that visibly in terms of people showing up at the doors. But it's a lot bigger than that, I think, below the surface as well.
Yeah, and to add to all of that, I work at YWCA Toronto, and we primarily work with women and women-led households. We serve around 13,000 people every year. We're actually one of the largest housing providers for women, and we provide more than 30 programs across 11 locations in the city. So we're very much embedded in the city of Toronto and in the challenges facing our community members. Many of our residents and program participants are survivors of gender-based violence, living on OW or ODSP, Indigenous, newcomers, racialized. And so food security for them really is a reflection of their class. And food insecurity is a symptom of the poverty that our systems are creating. COVID brought many labor market disruptions and increased caregiving responsibilities for women at home because of school closures. And so we know that many of the women in the communities that we serve, many of those women were pushed out of labor market. And then prior to that, we're actually part of the working poor, working lots of jobs that don't pay a lot, that don't have a lot of job security. And so women have been exiting the labor market. They were facing a higher job insecurities to begin with, a gender and racial wage gap. And for the women who rely on our social assistance system, the system is set up in such an inadequate way. Benefits are so low that it's really entrapping people in these vicious cycles of poverty. And all of this has contributed to rising access of food banks and just struggling to pay rent, maintaining tenancy, and a whole host of issues. The pandemic has just made the situation worse, frankly, and it hasn't really improved the lots of anyone that we serve and work with. And I think the report is just highlights that reality that we see on the front lines every day.
Yeah, I think just looking at the report and from what you all said, the pandemic really exposed the cracks in our system. And as you all mentioned, really just the inequities have just really been exposed and exacerbated. Now, also in the report, it really talks about resiliency. So I want to talk about that a little bit before we get into all the other stuff. Now, COVID-19, obviously a huge shock. The Who's Hungry report explores resiliency and how we can create greater resiliency when it comes to dealing with these shocks in the future as well. So question for each of you, what does resiliency mean to you? How would you define it? And in your line of work, how have you seen people coping and adapting to the past year and a half?
Well, to me, resiliency is just the ability to bounce back when things are bad. And I think one of the interesting things that I've experienced through this pandemic is how ordinary citizens have actually stepped up to fill those cracks. My team opened up in March of 2020 when everything shut down. One of the first groups to be impacted were seniors, especially food bank using seniors in Toronto community housing and other low income housing. And we put out a call to just ordinary citizens to step up and help seniors pick up food bank items, pick up groceries, et cetera. And 1,000 Torontonians just stepped up right away and helped them with that. So I think to me, that's resiliency. That's really when the community is stepping up to fill the gaps. And unfortunately, these gaps don't go away. And we thought that the pandemic, would have subsided by now, that service is no longer needed. That's not really the case. Seniors continue to call our hotline asking for the kind of support. So it's really there, and it's there in a very deep way.
Anyone else?
Sorry. On my end, the definition we sort of give in the report for resiliency is the ability to survive and adapt in the face of chronic stressors and acute shocks. That's the City of Toronto's definition, actually. They have a resiliency strategy. And I thought that was a really interesting definition because it addresses the fact that, every now and again, there's going to be an acute shock. There's going to be, it might not be a pandemic. I hope it won't be another pandemic, but there's going to be something, right? It could be a sudden job loss. It could be something, more societal. It could be a natural disaster. It could be an economic downturn. It could be a change in family status, that sort of thing. So there's so many different acute shocks that can happen. And so, how can households respond to that? But to me, the really interesting piece on this is those chronic stressors. So if we think of people, living in a situation where they chronically don't have enough income, how resilient are they going to be to those acute shocks? To me, that's the big question. And I don't think you really can be resilient when you are faced with poverty. I think you're set up to fail. So I think, to me, resiliency means a situation where people aren't burdened with those chronic stressors, where they aren't sure if they're going to have enough money to pay rent, where they're having to cobble together multiple jobs just to kind of make ends meet, and if that even. Resiliency, I think, really is about those systems and how people can kind of build a strong foundation where they can bounce back to those acute shocks, because those will be inevitable. We can't predict that, right? We just know that they will happen. But how can you bounce back to that? But I'll pass it over to Jasmine.
Yeah, I mean, it's such a good question and loaded question. I think so. Today is actually November 25th, and it's the International Day for the Elimination of Violence Against Women. And so when I think of resiliency, I think of the women who escape abuse, who risk literally losing everything, showing up to our shelters with a backpack in one hand and a kid on the other. And these women have to rebuild their lives, oftentimes losing their housing, sometimes losing their jobs, being very traumatized. And they are resilient. And many of these women succeed. And there's so many phenomenal stories that can attest to this. So resiliency is something that's inherent in all of us as human beings. But the question is, do we have the right community supports and government policies to really protect and foster that? That's what I think of when I think of resiliency.
Yeah, and that kind of leads me to the next question. And Jasmine, as you said, I mean, you work with so many women, and they've really been bearing the brunt of this pandemic. We also know that even though everyone's been affected by the pandemic, we know low-income households, we know racialized communities, they've been disproportionately affected. Those living with disabilities, Black, Indigenous people of color, newcomers, they have all been disproportionately impacted by this pandemic. So staying on the topic of resiliency, a question to all of you, and maybe Jasmine, you can start, is in what ways can we center equity when we look at our road to resiliency?
Yeah, that's a really good question as well. I mean, I think, and we as the YWCA Toronto, we've done a lot of work around talking about an equitable recovery plan. What are the lessons we've learned from this pandemic? What are some of the insights and key recommendations we can take forward? And so we have lobbied the government, all orders of government, as an individual organization and with community partners to talk about an equitable recovery plan at the city, to talk about a feminist recovery plan at the national level, and a gender responsive recovery plan at the provincial level. And so every step of the way, we are emphasizing the difference good government choices and policies can make in alleviating poverty, in targeting violence, and in creating healthier communities. And frankly, we don't have to reinvent the wheel. The answers are already out there. And it's sort of like affordable housing, affordable childcare, jobs that pay a living wage and offer sick days, a social assistance system that is adequate and doesn't trap people in substandard living conditions. So, things to the effect of like better labor market conditions and a better social safety net. Those are the things we can achieve as a society if we have political will and if we resource these things properly. So I think keeping that in mind and bring the right voices to policymakers. A lot of folks are struggling to survive and they just don't have the time for politics or advocacy. And so creating space for those voices to come forward and to build coalition around these concerns, and as community agencies, frankly, to really center the conversation, not in the concerns of middle-class white women, but in the concerns of our constituents, which are, frankly, newcomers, racialized women, Black women, Indigenous women, et cetera. And I think together we can achieve really great things, but we require the right kinds of stakeholders and allies in government to really reach that level.
Anyone else want to jump in?
Go next, and then
just how do we center equity in this conversation, the road to resiliency?
Absolutely. So I think, from our perspective, when we consider food as a human right, I think it provides us with a roadmap to how to actually do that work. Because when you center human rights, you have to take an approach that recognizes that, first of all, there needs to be non-discrimination. So, rights have to be held by everyone. Every single person is a rights holder, which means you need to know whose rights are not being met. So that's where kind of research and data comes in, and disaggregated data. So knowing not just, racialized populations, but actually knowing Black, Indigenous, all these different racialized groups, like what are the specific experiences, breaking it down by age, breaking it down by gender, et cetera. And then you need to be centering those voices, as Jasmine has mentioned, because I think without those fundamental components, you are not going to achieve people's fundamental human rights. You will build programs and policies that take an approach that sort of meets certain groups' needs, not others. It doesn't have that full picture. But I'd love to turn it over to Ty and ask. I know I'm not the moderator, but I'm going to ask anyways. Ty, you've been so involved with, particularly on the data side, with COVID and identifying what those gaps have been and where equity, helping the city, the province move to an equity-based approach. I think you've done it in action over the pandemic in such an incredible way. So I want to turn it over to you.
Yeah, I think it's just keeping the focus, giving voices to those communities. I think one thing that we've learned during the pandemic is that when you zero in on these neighborhoods and these communities and shed light on them, give voice to those individuals and use the data to kind of, present the facts, I think it does make a difference. And we try to do that at the local by, continuing to employ racialized journalists from those communities to tell their stories. And one clear example of just how this focus has really helped in the policy space is, we look at the way that the vaccine for the kids are being rolled out today. It's very different than the way the vaccines for adults were rolled out in April, where we had entire neighborhoods, Rexdale, Malvern, Thorncliffe Park, were completely forgotten. And, they were the neighborhoods that were hugely impacted by the pandemic in terms of infections and so forth, but they were one of the last to get the vaccines for a whole host of reasons. This time around, though, I think the city has done a very good job of saying, you know what, when we roll out the vaccine starting today, November 25th, yes, we'll have those mass vaccination clinics and the pharmacies, but we're also going to bring vaccines into these targeted schools in these neighborhoods, whether it's Jane and Finch or Thorncliffe Park or Malvern, and to do that from day one. So I think, you know, keeping the focus on that, telling the stories, using the data to make the point actually can make a difference. And I think, you know, we need to take these lessons from the pandemic and hopefully carry them forward beyond. And you know, it's little things like that. I mean, I say they're little, but they're not insignificant. But yes, I think for sure I agree with Jasmine. Like, we need to do the big policy changes too, in terms of housing policy, you know, income support, the social safety net, and all that. But I think there are also small policies that I think can go a long way in terms of, you know, rebalancing the picture.
Natalia, just looking at the Who's Hungry report, another startling statistic. Of course, as you mentioned, for the first time, new clients outnumbered existing clients at the food bank. So wondering if you can also talk a little bit more about what is behind this trend this year.
Absolutely. So, you know, this report covers off the time period of April 1st, 2020 until March 31st, 2021. So that was, you know, the height of unemployment in Ontario. So when the pandemic, first the lockdown was declared in March 2020, we saw food bank use increase basically instantaneously. We saw huge job losses in that time period. We saw a huge reduction in hours, and we're only now starting to see the unemployment rate kind of return back to what it was pre-pandemic, but the hours worked still haven't quite rebounded. So I think that is a big factor that increased the number of new clients coming to food banks. Was, you know, we saw this huge unemployment and underemployment. And at the same time, for a lot of Canadian households, people do not have savings. They simply don't have any kind of personal safety net if they lose their income. So we actually asked some of our respondents, you know, how long could you pay your rent or your mortgage if you lost your primary income? And 75% said they couldn't last a month even if they lost their primary income. So any loss to income is going to result in an immediate need for support, and that support might come from a food bank or another program in the city. And so I think, you know, again, going back to that resiliency idea, how resilient can people be if they don't even have any savings in the bank to kind of adapt when needed, especially when at the same time we're seeing that the cost of housing remains extremely high in Toronto. All of a sudden we saw, you know, inflation start growing, the price of food has gone up quite significantly. So there's all of these pressures on household finances, and so many households are not eligible. For people who were working, weren't eligible for employment insurance because that system was designed for a type of work that many people don't have anymore, which is a permanent full-time job. So, you know, our social safety net hadn't quite caught up, and I think we're very lucky that we saw a very swift rollout of pandemic income benefits, which certainly helps, but clearly, you know, they didn't completely prevent what we saw at food banks, but they certainly would have prevented many households from having to rely on the food bank.
And that leads to my next question for all of you, is that, yeah, as Talia, as you mentioned, with the pandemic benefits, we saw obviously CERB, the Canada Emergency Response Benefit, providing up to $2,000 a month to those who stopped working or had less hours. Now, even though these supports were, much higher than pre-pandemic income supports like welfare, and the government spent billions of dollars on these supports, we still saw, as we know, record-breaking food bank usage and growing inequality in food insecurity. So question for all of you, why do you think that is the case? And what happened?
I mean, I'm no expert here on this issue, but it feels like you have the twin issue of income not being high enough and living expenses being too high. I mean, one of the you know striking things in the report is that 68% of the income of those individuals using the food bank are spent on housing, like rent. I mean, that is an insanely high percentage. I think the benchmark is really should be about 30%, like no more than 30%. So that, I think, to me is the crunch that happens when income is not high enough and living expenses, especially rent, which is the biggest part of your expenses, is it's rising, and it's already way too high in Toronto.
I think to that question, the craziest notion to me, at least, sorry to use ableist language, but the silliest notion to me is that for recipients of social assistance, so OW and ODSP, when they rolled out CERB, there was a huge clawback of that money. So folks that are actually on the margins, the periphery of income security, really our society, receiving this additional money had to give so much of it back to the province. So the province was actually filling its coffers with funding from the federal government that was intended to alleviate the additional burdens the pandemic had introduced. That to me is just so difficult to wrap my head around, that income security is such a heightened issue during a pandemic, and yet the money wasn't trickling down or going to the community members and groups that could have really benefited from it during a time of heightened anxiety, and folks were holding on to their rent because they weren't sure what was going to happen. So it becomes a very frustrating situation of like, how are our systems as they have been set up, even sometimes with the really good intentions, still failing those who need support the most, who are facing systems of discrimination and oppression, right? And how do we penetrate through that? And we do really need more supports, but like supports that actually work for the folks who it's intended to serve.
Yeah, I think that's a really important point. And I think, in addition to what Ty and Jasmine had said, I think some of the other factors at play here are that, obviously the cost of living in Toronto is very, very high. So $2,000 a month in another location might get you a little bit further than in Toronto, where rent alone, I think the average cost of a one bedroom is something like $1,600. Don't quote me on that number, but it's quite high. So when we factor that in, we factor the growing costs, we factor in the fact that there were fewer community sports available for some of the pandemic as community agencies kind of adapted. There was certainly at the beginning, everybody was sort of thinking, how do we pivot our programming to make sure we can do it safely? So there certainly were barriers, particularly early on in the pandemic. On top of that, it's Jasmine mentioned, it's this uncertainty. So it's a pandemic. When we think, I see John Stapleton's on the line, and this is something he's talked a lot about, but when we think kind of behaviorally, in terms of psychology, when you're in such an uncertain environment, you're going to do everything you can to try to protect yourself for, what's unknown ahead. And so I think an interesting thing that merits further analysis is whether we saw some people be able to receive that CERB money, sort of invest in much needed household items, but that meant they didn't necessarily still have enough money for food. So they're still coming to the food bank, or they were putting that money aside for an even scarier potential future, but still relying on the food bank. So I think, when I look at the fact that we had these programs that rolled out very quickly, that were meant to alleviate that pandemic burden, I think it's incredible that happened. And I think that the lesson, for policymakers shouldn't be that, okay, well, we tried this and food bank visits still went up, so therefore they're not effective. I think that would be the wrong conclusion to come to here. I think the conclusion is that income supports are necessary, but not sufficient to help people to exit poverty. We need this whole social safety net, right? We need to look at employment, we need to have childcare, we need to have affordable housing. All these pieces need to come together. So things like CERB were one piece of that pie, a really important piece during the pandemic, particularly. Lots of lessons learned in terms of where we go from here. But I think it's really critical that we remember that this was a pandemic environment. And so the lesson shouldn't be, oh, it didn't work, therefore we should abandon income supports. I think the lesson needs to be, okay, let's figure out, how do we target this better? How do we make sure that people are getting exactly what they need, that there is that regional kind of difference, and that these interactions with other programs like social assistance, et cetera, don't actually inadvertently make people worse off because of this incredibly complex system that we've built, with a lot of regulations, a lot of what's the word I'm looking for? Regulations in terms of, you can do this, you can't do that, if you have to report on this. It's very hard for people receiving these benefits to kind of navigate those systems. So I think from a user perspective, we also have to consider that as well.
Yeah, I think that's a very good point. And talking about employment, for instance, getting into that topic, precarious employment, that is a huge issue that is particularly a particularly troubling development that was exposed by this pandemic, is just how many precarious workers we have. So, and Ty, I know that your issue of the fall issue of the local focuses on precarious employment. So I was wondering, can you tell us more about some of the highlights that were included?
Yeah, I think we were trying to explore what precarity is like in 2021. And to understand precarity, you almost have to look back like 50 years, which is the flip side of precarity, which is the standard employment relationship. People, what is a good job? The good manufacturing jobs in the post-war era, in manufacturing and otherwise, where you have, a good income, a pension, all the benefits that come along with it, and stability. Well, it turns out those types of standard employment relationships are now rarer and rarer. In fact, research from McMaster shows that only about 50% of the workforce in the GTA are in these standard employment relationships. The rest of us work in some form of precarious labor, the kind of labor that you see with gig workers, with warehouse workers, people in the hospitality industry, where it's not only low income, but you don't really know what's going to happen next week, whether you have the hours or the job. And I think it's that kind of insecurity that leads to people, not spending money on food, going hungry for a full day at a time, as the report highlighted, in order to kind of put away some cash for a rainy day kind of thing. And I think that's the kind of thing that's driving a lot of perhaps food bank use and so forth. So we kind of explore that in the issue. I can put it in the chat box, but yeah, like just trying to dive into what that looks like today.
And yeah, and we know that food, as you mentioned, Tan, usually the thing that people skimp on, right? They go, rent needs to be paid first, utilities and all that. And then they tend to leave stuff like food for last, and that could that would drive up the usage at the food banks. Now I want to turn to Jasmine a little bit now. And Jasmine, you talked about the impact the pandemic has had on women a bit at the beginning, but I wanted to ask if you can delve more into the impact of the crisis on women, because we know that the economic crisis brought on by the pandemic, women have really been bearing the brunt of it. So could you delve more into how this has been impacting women, the women that you work with, and particularly what would you like to see in terms of policy action to support women's employment?
Yes, that's a great question. And to Ty's point, and just listening you share that, I just feel like, and I'm sure this is a very obvious point and I'm preaching to the converted, but capitalism has really done a number on our society. And the effects today are really an outgrowth of an economic system that was built on exclusion and exploitation and colonialism, right? And capitalism was built around specific gender norms. And so when we think of this pandemic, I guess what is unique is around the disproportionate impacts on women. And so I won't kind of dwell on the problem. And I want to talk kind of focus more on the solutions, because we as YWCA Toronto and as a coalition of YWCA Ontario, and actually in fact with many other partners and folks with lived experience, have identified 3 policy changes or solutions that we think can really support various communities of women. One is more funding for women's employment, right? We need multi-year funding. There are a variety of fields, including pre-apprenticeship programs and upskilling programs for women that are not being funded adequately. And, you know, the labor minister is making many great investments and announcements, but like there are no gender targets associated with them. And so we need specific money earmarked, funding earmarked for women and women-led organizations, because the women that we work with and serve, they do face specific barriers and challenges in entering particularly the skilled trades, which we know is a growing field in Ontario. 1 out of 5 jobs in Ontario is actually in the skilled trades. So that's one thing, funding. The second one is the childcare agreement. I mean, I still don't understand why Ontario is the only province, that hasn't yet signed a federal childcare agreement. But we do know that childcare is inextricably linked with women's labor market participation. So access to affordable childcare will support women's re-entry into the labor market. And then the last piece is, and this is an overarching piece, this is a longer, bigger piece, this is more about capitalism, is action on precarious work, right? Improving labor and employment standards across the board so that women in feminized industries, and in fact, all workers, have economic security, have jobs with sick days and benefits, and don't have to struggle or work multiple jobs just to meet ends, make ends meet, pay for food or pay for rent. And so we need an economy that pays workers a living wage, where people who perform essential services don't have to struggle for survival. And if anything good has come out of the pandemic, it's exposing that kind of substandard, exploitative labor practices that are, frankly, will continue and worsen unless the government comes up with something more progressive than Bill 27. It's a step in the right direction, but we need way more. And we, the provincial government struck this advisory task force on the future of work over the summer, and we participated in it and had this whole submission, and so did many other folks. Where are the recommendations? We'd like to see them, because I'm sure in those recommendations, community partners have identified some concrete, effective solutions the government can enact if there is political will. So we really need the right leaders in positions of power, and we're going into an election. So that's all I want to say about that.
And I'm curious for all of you. I mean, Ontario recently announced it is increasing the minimum wage to $15. That will begin in January. What are your thoughts on? What are all your thoughts on that?
It's not enough. Too little, too late.
Yeah, I mean, it's good that it's happening instead of not happening, but it's too little, too late. Probably is the right way to frame it. When, one of the numbers in the report that also stuck with me was among the food bank users, the median income the median wage was $16 an hour. Correct me if I'm wrong, Talia. And, that's certainly above the minimum wage, but is below the real living wage in Toronto, which is, I think, somewhere around $22. So an hour. So yes, it's good to raise that bar, but that's really the basement. It's really no way to live in a city like Toronto. And that's assuming that you have a full-time job. Like I said, precarity means you're actually not working full-time hours and you're uncertain about what you're going to do next week, next month, next year.
Yeah, I agree. You know, it's a positive development, absolutely. You know, is there more to be done? Yes, I think some of the other areas, you know, in addition to the minimum wage, we also have to consider job protections for temporary and part-time contract workers, which were repealed in 2018, the equal pay provisions there. So that's a piece that I'd really like to see come back. And sick days. I don't think we can, you know, have a conversation about work in the context of a pandemic without talking about sick days, paid sick days, because I mean, people who have been researching this for a long time have known for a long time how important sick days are to maintaining community health and well-being and family health and well-being. But I think now that we've seen in the context of a pandemic, it's simply impossible to ignore just how critical paid sick days are to protecting everyone, you know, not just that individual worker, but everyone around them, and making sure that people can take that time when they need to protect the health and well-being of the people around them as well, and not have to make that difficult decision between, you know, do I go to work and potentially risk exposing people, or do I, you know, not have enough food to eat and not be able to afford groceries for my family. It's a position that nobody should be in. So I think there's still quite a bit to push for in the world of work.
I'm also a bit curious about all your thoughts on a basic income. Do you see that as an essential part of poverty reduction?
I have strong views on that. And from where I sit and from the community members we've spoken to and the folks that we work with, everyone in every shelter, employment, housing program that I've ever visited, they've expressed how much they would love a basic income program, because the essence of the matter is they're stuck in shelters because there aren't enough affordable housing. So they're on these huge wait lists. And currently, a single person on OW receives $733 a month. The issue here is the lack of money. And if you put a gender lens on a basic income, there are a lot of folks women who take on so much unpaid care responsibilities for both elders and children at home who would benefit from a basic income. So I think there are many compelling reasons why a basic income, in addition to other enhancements to our social safety net, would really improve the quality of life for many communities.
So I think I'm a bit more agnostic on the basic income than Jasmine. We've gotten to debate on this a couple times before. It's always fun. You know, I think there's a lot of pros with a basic income. I think Jasmine mentioned the adequacy of it. So, you know, making sure people get a higher amount of support than they're currently getting on our social assistance programs. And I think the other important component of basic income is the dignity piece. So right now, our social assistance system, to apply for social assistance, to receive it, to continue to receive it, you have to be closely monitored. You have to fill out every piece of paper under the sun. You know, for folks with disabilities, they have to prove their disability. Like there is very little dignity built into that system. It's a lot of oversight. People aren't trusted with their money. So I think those are both arguments in favor of a basic income. Where I get a little bit less enthusiastic about it is in terms of the nitty-gritty. I think that when we look to how it might actually work and roll out, I think that's where it starts to get a bit more complicated. What I could see as a step in that direction is not necessarily a universal basic income, but basic incomes. So for example, people with disability, right now, Ontario Disability Support Program, ODSP, is a horrendous program, to be quite honest. It does not accomplish what it should, which is ensuring people with disabilities have a life of dignity. So I think, you know, that would be a great starting place. I think it's just, you know, we have to balance a basic income with basic services. So making sure that we're not giving people a basic income and expecting them to pay out of pocket for things like health coverage, dental coverage, which tend to come hand in hand with our social assistance programs and is a really important part. So if I could wave my magic wand and have, universal childcare and pharmacare and universal dental coverage, plus an adequate standard of living income for everyone, I would be all for that. I think it's just a matter of what are the mechanics to actually kind of get there?
Ty, do you have any thoughts? If not, I can get to, I think we have some audience questions coming in.
Yeah, let's do that.
Yeah, let's do it. We're going to try to get to as many of these as we can. So let's get right to it. The first question we have for all the panelists is, more than half of food bank clients report a disability or health condition that impacts their day-to-day life. Can you speak more to the policies and supports needed to help move people with disabilities out of poverty and food insecurity? And the question is also, how will Bill C-35, the Canada Disability Benefit Act, not being readdressed within the current federal government, affect poverty among disabled Canadians?
I can start on that one. So I'd say, it's unacceptable that we see the level of deep poverty that we see amongst people with disabilities. It's simply unacceptable. I think that has to be our starting place. And I think the most important piece is centering people with disability in the policy directions, because I think programs like ODSP are not client centered. There's a social assistance transformation happening right now. The government of Ontario is making a lot of big scale changes to that program, and yet people with disabilities who are the recipients of ODSP haven't really been consulted, haven't been engaged in that process. So that fundamentally is not going to succeed. There's not going to be a successful transformation of that until that happens. So I think that's one piece. And then I think, income adequacy is just fundamental to achieving a life of dignity, and that's what we're missing right now. So at the federal level, there is the development of a new disability benefit. Where that's going to land, I don't know, but I think I'm very hopeful that it will come to a place that is very different than where we're at right now, from a social assistance perspective, where there is that trust, that dignity built in, and those interactions between programs need to be considered. Because if people are getting federal benefits and then as a result they lose their provincial benefits and end up worse off, that's something that needs to be avoided as well. I'll turn over to if Jasmine or Ty want to pick up on that.
Yeah, just to add to that, we need to improve our provincial system. So ODSP, that system is really, as Talia mentioned, it's quite broken, because, for example, if you get your disability claim denied, for you to get a hearing in the courts, that could take years, because at the tribunal level, they're not actually appointing enough judges. Right. And so a person living with a disability has to survive on $1,100 a month. And we know that the cost of a studio apartment in Toronto is at least $1,500 a month. So where does that leave a huge segment of the population? And so then there was this move at the federal level to supplement that income through the introduction of a national disability program. And because now we had a new election, I don't know if the government will pick that up again, but it absolutely needs to, because the income security piece for folks living with disabilities is just really inadequate, and it's a failure that reflects system design. So I hope that the federal government continues leadership on that front and really introduces a system that's modeled after the old age security system or the guaranteed income supplement system or whatever else, to put more money in the hands of folks living with disabilities. And to that point, while I think the future of work should be decent work for everyone, a good life shouldn't be contingent on a good job. There will always be a certain segment of our society who, for whatever reason, can't participate in the labor market, and they are entitled to the realization of their human rights and their dignity as much as any other person. And we as a society have to really prioritize their well-being once and for all. I think a lot of the issues facing communities who live with disabilities is the fact that us able-bodied folks just simply don't care, and that needs to change.
And we have another question from an audience member, and they say Jasmine raises a very valid point. Reinventing the wheel is not needed, and we need active government allies providing a seat at the decision-making government tables. Question is, how can the social sector stop being labeled the third sector and become part of a hybrid sector where private, public, and social collaborate on solutions to achieve the report's resilience recommendations?
Very good question and an interesting framing. You know, here's my take on that, and I don't know if it really answers the question. I think the social services sector or the nonprofit sector has just become a catch-all sector for all the issues the government doesn't really want to deal with and is just downloading on us. And so what we're finding, for example, at YWCA Toronto, but this is not a unique problem to us, is that we don't actually get adequately funded to offer the services that our communities need, like supportive housing. And so we have to end up investing a lot of time and money into fundraising and hiring folks for fundraising just to offer society the services that clearly folks need in order to survive and thrive. And so what I would like to see is more opportunity to work together collaboratively, not in a let's check off the box way, but in an actual, these are experts in their communities, and let's bring forward all of the sectors to work on these knotty social problems together. If the government could actually create space for that, I would be so enthralled by that. But what I see happen instead is like a consultation every other whenever, when it's convenient, and then a political agenda that's very ideologically driven. And that to me is not part of the solution. That to me is just like an optics and a PR thing. And so I think together we're stronger, but is there will to do so? Again, it comes back to government will, I think. I don't know if that answered the question, though. No, I think I'm just ranting. No, my angry rants.
No, you made many good points. Thank you for that, Jasmine. We do have a couple more questions, and we'll try to get through some of them because I think one thing that I wanted to touch on that we didn't get to was more on affordable housing. And so bringing this in with an audience question, many of these food bank clients, 80% are spending more than half of their income on rent, as we know. Now, all levels of government have a role to play in building and maintaining affordable housing, but it seems like we are just falling further and further behind. The question is, what role do you see affordable housing playing in our economic recovery, and what actions are needed? I'll open up the floor.
I mean, I think it's huge. Like going back to what we were saying earlier, like 60, 70% of your income is spent on housing. That's an issue, right? And it's an issue that, you know, income alone, whether it's basic income or whatnot, it can't solve. Like this is a very Toronto issue. And I think there needs to be more focus on affordable housing. I know the city is doing some work. Like recently there's inclusionary zoning is supposed to now force developers to set aside a certain percentage of the square footage of new developments around subway lines towards affordable housing. But, you know, I think a lot more can be done. I think those set asides are still relatively small compared to what I think is really required to make the city affordable. in the meantime, we have huge redevelopments in places like Regent Park and Lawrence Heights. And, for the most part, these redevelopments are replacing existing TCH units. They're not really creating new units, and so these are really big missed opportunities for the city as we think about how to redevelop the stock of affordable housing that we have. So, I think for sure there's a lot more that can be done. And I think there's been a lot of missed opportunities in the last few years that I think we need to begin to correct.
Yeah, the more I delve deeper and deeper into the world of affordable housing, the more I'm struck by the fact that I think this is one of the most complex and important challenges we are facing in Canada today. And the housing challenges vary so much by jurisdiction. So in an urban center like Toronto versus, in some of our northern territories, the situation is so different. But I think why housing is so challenging is because there are so many players that have a different role to play. We've got government, we have private developers, we have the general public. So we have nonprofit providers. And all these groups have different interests potentially. So I think that it makes it really challenging because we have such push-pull kind of on some of these policies. I think, Ty, you mentioned inclusionary zoning in Toronto. So I think what I've noticed lately in government is that all levels of government are talking about affordable housing in a way that I haven't seen in my lifetime. Like it seems to be the top policy priority for all levels of government. And that's a good thing, but I think there's still no real consensus on where to channel that energy and what are the most effective solutions. I think ultimately we choose every tool in our toolkit. So, the city of Toronto, they passed inclusionary zoning, which is a wonderful development. But at the same, a couple weeks earlier, they basically deferred a vote indefinitely on regulating multi-tenant housing, which basically means, making sure that rooming houses are legalized. There's a framework for approving them so that tenants are safe, so that the illegal houses that are operating are kind of brought under this umbrella to ensure safety. So, it's been a bit of a mixed bag, and we need leadership at every level to advance affordable housing. And there's a whole spectrum. There's building affordable housing. There is maintaining the existing stock of affordable housing, which is quite frankly falling apart, especially our social housing units. There is portable housing benefits. So the Canada-Ontario Housing Benefit was introduced, I don't know, time has no meaning anymore, maybe 2 years ago or something like that. There's regulatory changes, like inclusionary zoning or other regulations. So I think we have to be looking across the entire spectrum and using every tool at our disposal on affordable housing, because it's just growing in scale, where we are falling further and further behind, and it's just going to keep growing until I think there is that coordination across the different levels of government as well.
Yeah, just to add to that, we need a range of housing. We need transitional housing. We need deeply affordable housing. We need housing for specifically women and women-led families. One of the things that we were able to do in 2017 as a YWCA movement is influence the national housing strategy. So actually 25% of all of that funding is targeted towards women, housing for women and women-led families. But what we're seeing is like now there's a lot of movement and traction on housing, and people are understanding all of the needs for housing and supportive housing, but it's so slow to build these units. Truly, the Housing TO plan has a goal of 40,000 new units by 2030, and it's just not enough. It doesn't even keep up with the existing demand. And so we need more robust government action more quickly and in collaboration with more community partners who are actually able to build housing. And there are a lot of there's still a lot of red tapes for a nonprofit housing provider to build housing, and so there are some ways, especially from a regulatory lens, that can support all sorts of players to come in to provide specifically Indigenous housing and housing for women and housing for folks living with disabilities, et cetera. So I think there are opportunities there, and I'm happy to know that the governments are exploring solutions, but again, the homelessness crisis and just like the unaffordability of the existing stock, it's a huge problem. And the housing first model really suggests that without secure, stable housing for an individual in their life cycle, everything else kind of falls apart. So housing is the first step towards achieving dignity, stability, health in someone's life. So we need more, and we need it quicker.
Yeah, those are all very good points. Thank you all for bringing that up. And I do want to end with, we're reaching that time when we have to wrap up audience questions. And I just want to remind everyone, first of all, I want to thank everyone for their questions. I think they were all very important questions. And for those that we weren't able to get to, as I mentioned, we will either follow up or your question will be saved for a future event. So wait for someone to follow up. And I actually do want to we do have an audience question that I want to tie into the final question that I have for all of you. And it goes back to, what can everyday people do? Because we have all these startling statistics and all these issues, and sometimes you feel a bit overwhelmed. Like, what can I, as an ordinary citizen, do? So my final question, which I'll tie into an audience question, is, for all of you, what can viewers do to work towards building resiliency in Toronto and their communities? And the audience question that kind of ties in with that is, how can we all participate in a meaningful way to influencing government in a way where we can make those in positions of power really pay attention?
Vote, and vote for the people that you think will make it happen. That's the first step. Sorry, I don't have much more to say than that.
No, that's important. That's important. Anyone else? I'll repeat the final.
Oh, sorry. Sorry to interrupt. I always give the generic, like, just get involved with the issues and find your niche, and like whatever else, does whatever feels right to you. It's believing in the power of your voice, whether or not you can vote. I think voting is a really important mechanism, and it's really important for our society, but recognizing that maybe not everyone wants to vote or is able to vote. Get involved with the issues in your community at a very local level. It could be in your building. It could be just with other moms or folks that share your concerns, and lean into the power of your voice, and don't let politicians get away with the stuff that they're getting away with. Try to hold folks accountable. And if that means joining an organization, great. But if that just means collectively a grassroots movement, that's great too. We need all hands on deck, and we need all tactics.
I'll just build on that. I think, I do a lot of speaking engagements with high school students and university students. And I think there's often a bit of trepidation about, how do I affect change, and, some intimidation too. And, I always say that you are the boss of elected officials. They actually report to you. So, it's your right and your privilege to contact your elected representative and say, I'm not seeing what I want to be seeing. I want stronger action on affordable housing or on poverty reduction. And it's their job to respond to you. So you're their boss, and to use that power and that responsibility and that privilege with care to advocate for the issues that matter to you. I would also say that, I agree fully with everything that's been said about, elections are an important time. Getting involved with a local organization is a great way. I'll do a little plug here that with the provincial election coming up, we are encouraging people to take action. So you can go to dailybread.ca/take action. We have a letter set up that you can send, in just basically a click to all the party leaders to say, we want a stronger commitment. We want a poverty reduction target, 50% reduction in poverty by 2030. And that helps get things on the agenda. That helps set the stage for the election, make it an election issue, get to see some commitments made. Parties will often try to, best each other on their commitments. So it's a great time to mobilize. And then as Jasmine said, if that doesn't feel right for you, if you don't want to engage directly with elected representatives, you don't have to. You can go to a coalition meeting. You can provide input to support others in doing that work. You can participate in consultation. Like, there's so many ways to share your voice, but I think fundamentally it just is about taking the plunge, and the more you do it, the easier it becomes once you start trusting in your own voice. And so I hope, we've talked a lot about a lot of heavy issues today, and there's so much to be done, but I think, what I would hope people kind of take away from this is just, there is so much potential too, right? We have seen huge policy changes in the past year that were unprecedented. Like the fact that we had a program like CERB, the fact that we've just, we've seen investments like we've never seen before in protecting people's health and well-being. And we really need to just keep up that momentum. And I really genuinely believe that we can actually tackle these issues. We just need that public will that will influence the political will. So I hope you leave with a sense of optimism that we can actually do these things. There's very concrete actions that can happen that will actually address some of these issues at hand.
And if I can just add to my very simple comment about voting, is I think also to not object to the things that you're advocating for simply because it's inconvenient for you. And I see this a lot in a lot of the NIMBYism that's going on. Yes, intellectually you might believe in affordable housing, but if somebody tries to put a modular housing unit in your neighborhood, or a hotel shelter in your neighborhood, and people are out there, picketing and objecting to that because it ruins your neighborhood character or what have you. I think these things are very hard to do, and it's human nature to kind of protect our own turf. But I think it's hard to really think that way and still try to advocate for the types of progressive things that, we all say we want to do.
Yeah, I think those are all very good points, and I like how we're ending on a kind of a note of optimism, Talia, as you were mentioning, because we do want to feel that we can do something collectively, individually, to make things better, to build resiliency, and to push for change. So I think that's really important to end on that. And on that note, I want to thank all three of you, Talia, Ty, Jasmine. Thank you all so much for your time and all your insights this afternoon. For me, and I'm sure for those listening, extremely enlightening listening to each of you touch on very important points this afternoon. And it's been, for me, a privilege to be able to moderate this panel with you guys. So, and also thank you to the Daily Bread and North York Harvest for having me. It's been a pleasure. And right now, I would like to hand things over to Ryan Noble, CEO of North York Harvest, for some final remarks. Ryan.
Thanks, Kelda. I think my video needs to be turned on by one of the moderators or one of the administrators. Great, thank you. So thank you, Kelda, and let me first start by thanking you for moderating an excellent panel today and taking the time to be with us. I'd also like to extend my thanks to Talia, to Ty, and to Jasmine for a really informative, really rich, really fantastic discussion this afternoon. So thank you for that. I will try not to bring us too far off the optimistic departure point that Talia laid for us, but just a couple of comments, I suppose. The title, the subtitle of the report, and the title of this webinar was From Crisis to Resilience. And for those of us in this space, I'll be honest that sometimes you can feel like we put these reports out. We've been contributing to the Who's Hungry report for I don't even know how long, many years now. And sometimes you can feel like we're saying the same message and we're not really sort of getting traction. And it's, we talk about crisis, and I think, and it's easy, frankly, to become a little callous to a lot of the statistics and a lot of the numbers. But I think this report really drives home the crisis that our city is in, and the cracks in our society that we've discussed today, and that the pandemic has really laid bare. And not to get too, as I said, not to bring pessimism back to the discussion. Almost 1.5 million visits to food banks in a city of just under 3 million people. 1 in 3 of individuals visiting food banks who have gone without food for an entire day, and the majority of those people that's an occurrence that happens on a regular basis. And those are pretty stunning numbers. And as I said, really does underline the crisis that we find ourselves in. And the report then, obviously, as we've discussed, really shows that in addition to being in a crisis, we are in many ways heading in the wrong direction and towards a critical breaking point. We see that in the number of new clients versus existing clients who've come in through the time of the pandemic as unemployment and precarious employment has skyrocketed. And we also see, we had a great discussion around social assistance for those existing clients continuing to struggle with inadequate income supports and a cost of living that continues to increase and sets people further behind. So I think the bottom line is, we need to act. We need to take action. We need to take action as a society. Our policymakers need to make real commitments and real investments, both in addressing the immediate fallout of the pandemic. So in terms of people who are still struggling with precarious employment, precarious housing as a direct result of the pandemic. And then as we look to the future, to really address this lack of resilience that the Who's Hungry report really demonstrates, and make the investments that we need in dramatically increasing access to affordable housing, making investments in affordable childcare, ensuring that social assistance actually reflects the true cost of living, and really promoting decent work and reducing precarious work across the labor market, across our economy. And to that point, in terms of action, I think there are some, this is where I would agree strongly with Talia. There is tremendous opportunity here. So what people can do, I would say, an immediate thing is read the report. If you haven't had that opportunity to do so, and share it amongst your friends, your networks, your family members. Share that on your social media. The 2 big stats you can walk away with today and tell somebody about. Did you know that there was 1.5 million, just under 1.45 million visits to food banks in the city last year? Did you know that 1 in 3 people? So, wherever you go after this call, if you see a group of people, everything count. And just to give you a sense of what 1 in 3 actually looks like, how significant that number is of people that are missing meals for an entire day. As has been said, we have elections coming up. People will be coming and knocking on your doors. Hold them accountable to that. Participate through organizations like Daily Bread, as Talia outlined, North York Harvest, and continue to push those issues at whatever level you're comfortable, able, and accessible to be able to do. Whether that's, again, at your family, in your workplace, or if you're able to commit at larger sort of political levels, that's great as well. We can all take some action, and we can all take some action today. And so I would really encourage all of you who have taken the time, to spend with us this afternoon, to help make sure that conversation continues once we wrap up today. So with that, I want to thank you, Kelda, for moderating a fantastic discussion. Thank you, Talia, Ty, and Jasmine, and thank all of you on the line for spending some time with us today, for reading the Who's Hungry report, sharing it, and taking action. So that we can move as we've called it today, from crisis to resilience. Thank you, everyone.